Hello, it's Joseph de Pfeiffer, founder of Surgical Robotics Technology. I'm absolutely delighted to be here today with Amer Raza, Consultant Gynaecologist at Cromwell Hospital, winners of the Surgical Robotics Industry Awards. Firstly, congratulations on winning the Outstanding Healthcare Provider Award. What does this recognition from the global surgical robotics community mean to Cromwell Hospital?
Thank you very much, and very delighted to have received this honour on behalf of you to Cromwell Hospital. And it really reflects the hard work and the achievement of the whole hospital. This award is simply a nomination and reflection of the hard work which goes in, right from our nurses, theatre staff, doctors, anaesthetists, even the technology like intuitive robotics we use, and everyone in that system. So thank you very much. It's a great honour for everybody to have it.
Brilliant. And could you please provide an overview to your role at the hospital?
I'm a consultant gynecologist. I'm a robotic surgeon. I used to be a minimal access laparoscopic surgeon, which set the foundation of this work we do now. And from laparoscopic surgery, I became a robotic surgeon in 2021. And we were using multi-port Da Vinci robotic system, and since then now we have worked on the system so much that we are one of the largest units of endometriosis in the country. We do a huge number of surgical operating in gynecology, and not only gynecology myself, but obviously we have other specialties working along with us as well.
Brilliant. And could you talk a little bit more about the robotic surgery program that Cromwell offers?
Surgical program in robotics in Cromwell has been a very successful program. It is one of the unique programs, I will believe, in a country where so many specialties work on the same robotic system and innovating many new procedures. For example, in my own gynecology field, we are doing complex endometriosis to myomectomies and hysterectomies for large fibroid uteruses. And that technology innovation then led us to move to now single port robotic surgery. So we have multi-port robotic surgery with Xi. Now we have moved on to single port, and Cromwell Hospital now is the only hospital in the country doing single port robotic surgery. So, and then one thing about robotic program is that we are operating and we're giving the best services to our patients. But second thing is, along with it, is the innovation, implication of the artificial intelligence, and the teaching and training which is going on the back of it as well. So training program and the program as surgical program in Cromwell Hospital is very large and big, involving so many other specialties as well. We have colorectal, urology, thoracic, upper abdominal, upper GI, even head and neck, and now cardiac. There's a huge range of operating of activity which goes on in robotics.
Excellent. And you lead the centre, the International Centre of Endometriosis at the Cromwell Hospital. Could you tell us a little bit more about that?
We set up the International Centre for Endometriosis in 2022, and today, sitting after 3 years today, we are now the largest centre in the UK, including all private and NHS services. But being largest was not the objective. It is to provide the best and the top services to all of our patients who come to us as well. And we're very fortunate to have a huge multidisciplinary approach where we have colorectal surgeon, urology, thoracic, gynecology. We all come together to treat complex diseases such as endometriosis. So International Centre for Endometriosis now is a very big multidisciplinary team and providing the most innovative treatment such as single port robotics to treat this complex disease. So on one side is innovation, is all the fine treatments and technology we are using. On other side is a very kind, passionate and caring services for our patient. And these two things together allowed us to be where we are now.
Incredible. And Cromwell Hospital has achieved many, some of which you've mentioned, impressive milestones with robotic surgery, notably being the first hospital in the UK to perform gynaecology and HPB procedures with Da Vinci SP. What are some of the next milestones you're working towards?
We have been very fortunate as clinicians to be in Cromwell Hospital, where we have very daring and excellent leadership, a visionary leadership. Our Chief Operating Officer, Mr. Phil Lewis, and all the team along with him are very forward-looking team, and that allowed us and enabled us and gave us a foundation and program on which we can build this beautiful building of robotic surgery and innovation in every subspecialty along with HPB, as you just mentioned. Future is massive. where we have now set up this very successful Xi multi-port and single port robotic system. Next thing is how can we scale it? How we can do more and more operation? How can we use this capacity to provide even more complex operation and even more new operations? As I said, single port is a big thing. Other thing we are looking at now, how we can bring in teaching and training into that system as well. We are now becoming one of the major centers for intuitive proctorship program, where trainees and doctors come from all over Europe to UK to our hospital, Cromwell Hospital, to watch and observe the robotic operations. And third thing is that we are now doing robotic courses in Cromwell Hospital. So right from the excellence in clinical provision to our patients, all the way to teaching and training, that's our big thing where we are heading to now in the future.
Brilliant. And my final question, which I think leads on nicely, is what advice would you have for the next generation of surgeons, innovators, engineers that are looking to shape the future of surgical robotics?
The future is very bright for all the young people who are looking for future now. Robotics and artificial intelligence are creating that mix where excellence in clinical care and provision of health services will be an amazing thing. The way things are changing, they are giving now better tools, better diagnostic tools, therapeutic tools to treat patients than ever before. From robotic surgery to telesurgery, teleoperating, telementoring, going into microsurgery, all of a sudden we see the science and the clinical science is exploding in technology, which is actually giving doctors better and better tool to treat the patients, because end of the day, that's the main objective. So I will say we are in the very exciting times, looking ahead now, where technology is coming along, and we have to embrace these technologies to do better for our patients.
Great. Well, thank you very much for your time today, and congratulations again on receiving the award.
Thank you very much. Thanks.
Thank you.
Thank you.